I spent over 25 years working in a psychiatric hospital, 2 decades working in addiction medicine. I ran a treatment center. And probably 15 years ago, I was telling my staff that there's a tsunami coming. And that tsunami is the addiction and the dependency upon prescription pain medication and prescription benzodiazepines, the anxiety medication. We are 5% of the world's population here in the United States, and we consume 80% of the world's pain medication. Do you think there's a problem? 5% of the population, 80% of the prescription opiates. It's ridiculous. It's completely out of control. Of course, I think people are aware that poor Prince has succumbed to this now commonplace condition, which is opioid pain medication dependency. These medicines were designed for, in his case, it was fentanyl. And fentanyl is a medication designed for end of life and cancer. It was not meant to be used for pain, chronic pain. And in fact, there's no evidence, let me underline this, no evidence that opioid pain medication are useful in the treatment of chronic pain. In fact, often makes things worse and endangers people's life. Why would we recommend something to patients that makes them worse and does not help them and endangers them? We're not being mean. It's just the fact about these medication. Prince's case, we hear that he had at the autopsy, he had a scar in his hip, which suggests he had a hip procedure. My suspicion is that after that hip procedure, he was appropriately given opiates. Then the pain got worse from the opiates, so he got caught in this cycle that so many people get caught in of escalating pain. It's called hyperalgesia, withdrawal, pursuit of the medicine, more pain, pursuit of the pain relievers, and now you're in a cycle and you end up on fentanyl. Don't get caught up in the fact that fentanyl is 100 times stronger than morphine or 100 times stronger than heroin, whatever. Look, you just use less to get the same effects, or use more of the morphine if you want to get the same effect of the fentanyl. It's all opiates. It's all dangerous. It's all bad. What's weird about fentanyl in his case is that to get toxic levels, the medical examiner reported that he had toxic levels in his blood. To get toxic levels, there's only a couple ways you can do that. Not by traditional delivery means, you don't get toxic levels. It's a patch or a lollipop, believe it or not, that people are given to deliver low levels of fentanyl to them. But my patients, when they want to get high, they'll take the patches off and cut them open and suck on them, move it and get it through their cheek membrane. There are now sublingual fentanyl tablets out there, so people can take lots of those. Hard to get toxic levels that way, or they can shoot it. They can open up those patches and shoot it, which patients do as well. Haven't heard anything about there being track marks in Prince's case. I can't imagine he went to IV use and no one knew about it. But again, in Minnesota, you don't get the complete reports. We will never get the toxicology, and we will never get the complete autopsy. As it pertains to toxicology, I believe that I'm convinced that they would also find, if we were allowed to see it, you would find there was benzodiazepine medication there. If somebody's going to die of a accidental, self-administered, like Prince, overdose of opioids and opiates, it's going to be complex with a medication called a benzodiazepine, a sleeping medicine or an anxiety medicine. And together, those two medicines, the opiates and the benzos, suppress respirations. In Prince's case, it's sort of bizarre that he was found in an elevator. Usually people are found in bed. They take their medication late in the day, they're sleepy, they take their pain medicine, take their anxiety medicine, they stop breathing. In Prince's case, what unfortunately it seems happened is he was taking such high levels of the fentanyl that he was so severely intoxicated he fell down and could not get up, passed out, stopped breathing, and that's where they found him. This is a massive problem. There's controversy on how to treat it. Some people are treating it with something called Suboxone, which is replacement therapy like methadone. Can be life-saving for some people, but it does make you sort of chronically ill and chronically dependent on a medication. Personally, I believe anyone with resources and motivation should at least try abstinence-based therapy. Problem with abstinence therapy is, on average, it takes 8 treatments to get to 1 year of sobriety. You have to keep at it and at it and at it. It's a lot of work. It's a lot of dedication. It requires a lot of whole team around you helping you do it, and it requires a lot of 12-step work. So, unfortunately, this is the problem of our time. No one intended it. There was not some evil empire foisting this on us. It was people well-intentioned, trying to treat pain. Unfortunately, we took a philosophy 20 years ago that pain is what the patient says it is, and when the patient is under the influence of these opiates, what they say it is a distortion. When people would come in for treatment with me, they would always say, and again, latter part of my career, I was just taking chronic pain patients on opiates off opiates. You'd ask them, what's your pain on a scale of 10? They would never say 10. They'd always say 15 or 20. We'd take them off the opiates. They'd have a miserable couple of weeks. Then after 2 weeks, they would stop talking about their pain. They would only talk about it when prompted, And when asked on a scale of 10, they would say it's a 4 or a 5 on no treatment, just taking them off the opiate. So if somebody is on a low dose of an opiate and their pain is controlled, of course I'm not talking about you. I'm talking about the people that have hyperalgesia and withdrawal and are caught in this horrible cycle. Some of it is just dependency, in the sense that they're just tolerance and withdrawal and escalating pain. When you take that person who's a dependent patient off the drug, they'll stop using. If they have addiction, they will not be able to stop and will keep pursuing the drug even after they've been taken off it. Unfortunately, there's an excessive focus on withdrawal, which is easy. I've never had a problem getting somebody off opiates. There are many different options to do so. People are afraid of it. It's uncomfortable. It's easy as compared to staying off the opiate if you're an addict. That becomes a lifelong issue. So it's a problem. I'm sorry that we're here, but we are here. We consume 5%, 80% of the world's opiates, and we represent 5% of the population. We got a problem.